There's an enormous amount of research taking place with psychedelics, with psilocybin, with ibogaine, with MDMA, with 5-MeO-DMT, with a whole host. And the healing potential of these are incredible. And yet they've been kept away from people by these prohibitionist laws. And so it's enormously frustrating and tragic. And yet, if we let that overwhelm us, then we're not going to work as hard to make it happen. So I've had to learn how to deal with that frustration.
It was just a gross distortion of the legal system. You know, there's no reason why they should be illegal. As long as you have whiskey and you can get Adderall easily on a prescription, like, and oxycodone is readily prescribed, like, this is crazy.
Well, it's counterproductive.
Yes.
It's not even, like stopping a lot of the benefits. It's actually creating more harms. Just as one example, my father was a pediatrician. He's no longer alive, but he worked on the first study with crack babies. He and his partners did the pediatric evaluation.
Oy.
And you remember this in the 80s.
Yeah.
This idea was that there's going to be this whole generation of super predators, and these women that were pregnant with crack were having babies that were addicted, and they were going to be mentally deficient and prone to violence, and this whole scenario that Reagan amplified.
Right.
And what my father and his partners found out was that that really these kids could recover, that they could do better, that it was mostly malnutrition, poverty. It's not like fetal alcohol syndrome, that it was really not this direct connection between the crack cocaine and the problems with these kids. But what he found was that the women that were pregnant and were addicted were driven away
The fucking
from...
phone is dinging again, man. Just put it on Do Not Disturb.
Yeah, let me just turn it off.
All you boomers and your goddamn gadgets.
Boomers. Yeah. But he found that these women were dissuaded from seeking treatment.
Why?
Because they were worried that they would have their babies taken away from them, because they were worried they were going to go to jail. So the drug war is counterproductive in that the people that need the help the most are driven away from seeking it because of the stigma and shame and criminality.
Right. But then they screw up sometimes and do like what Portland did, where they just go, everybody just do whatever you want. And then, unfortunately, you've already set a culture where you've allowed people to do fentanyl in the street and meth and whatever else they want. And then the laws pass where you decriminalize everything. It's legal free-for-all.
Yeah.
And then, unfortunately, you have chaos. And then they pulled back the law because it was just too much.
Yeah.
People were going there just so they could get high.
Well, that's the important point, what you just said. People were going there. So what that means is that, and we saw this in Zurich. So there was a place in Zurich multiple decades ago called Needle Park, where they decided to provide access to healthcare, access to safe injection sites, things like this for heroin addicts and others in Zurich. And it was working because when you treat people as humans like that, they will often seek other treatment. And then if they're not necessarily criminals, but then people come from all over and overwhelm the capacity because it's this one humane site. And then it became an open-air drug market. Just people from all over Europe started coming, and then they had the backlash.
Yeah.
So I think it's something somewhat similar in Portland, where you try some of these things on a local basis, but then it attracts people from all over, and then it turns into the opposite of what they'd hoped.
Right. Yeah, and I just think also they had gone through the whole defund the police thing. So they were just overwhelmed by cases, and the Portland's just out of control. It was a lovely place a few years ago. Just a lovely place. 10 years ago, Portland was amazing. It's all a bunch of sweethearts and hippies. They were like so calm, and something happened, and people got radicalized, and then the tents, the people, the camping on the street.
Yeah.
Once that happened, and you tolerated people just putting tents up in the middle of the city, it's like, don't ignore these people. Like, either help them out, or tell them they have to move, or do something. You can't just clog up your city with mentally ill drug addicts who are in tents. That's crazy.
It is, and it's hard to have these local solutions because it attracts those people.
Exactly.
So
people probably got on trains to go to Portland and get high.
They did. So these kind of solutions, I think people take the wrong idea from them, that the solution itself was the wrong idea.
Yeah.
But I think it's when you do it on a local basis like that and not have it widely distributed. So basically the idea is that you have people that have problems with substance abuse of all kinds. We don't criminalize people who are alcoholics. They can go to AA. They can go to other things. They're not stigmatized, and they're not worried that they're going to be arrested.
Right.
And yet they can go for help, and you have a lot of people that actually do that.
Yeah.
And I think that's the kind of humane approach. But
that's
it
where
needs
we
to
should be leaning as a society. That's a healthy, intelligent society. And also, we should be paying attention to the people that report great benefits. Like, there's just too many. Well, luckily, we have guys like Rick Perry. And Rick Perry, who was the Republican governor of Texas, is now really in full support of this iBegin initiative. It's wonderful.
Yes. Well, Rick Perry will be speaking at the conference.
Fantastic.
As
Love
will
that guy.
Brian
Such a nice
Hubbard.
guy.
So you
Love Brian Hubbard, too.
The work that you did to have Rick Perry and Brian Hubbard on your show, and how much that brought attention to the iBegin possibilities, was incredible.
Well, it's my feeling is if a guy like Rick Perry, who's this like straight-nosed, conservative, right-wing kind of a guy, if he can open up his eyes to that and open up his heart to that, it's available for everybody. And there's this very binary position that people take in regards to their thoughts on psychedelics. It's either it's for losers and people that want to escape reality, or if you're on the side of the people that have experienced it, you don't get any of that, which is so weird for me. So the people that think that it's for losers and it's all just a bunch of people just trying to escape reality and they're lazy and none of those people saying that have ever done it. So if you can get just a few of them to do it and tell their friends, if we had like legitimate therapy centers, because everybody needs a little help.
Yes.
I'm not saying you need to get off heroin. I'm not saying you're coming back from Afghanistan. I'm not saying anything crazy, but like everybody could use just a little therapeutic help to give you a fresh perspective. And I think if that was available to a lot of people that are just generally depressed, I think we could change the tone of the country. I really do. Because one of the things that bums me out the most about especially the interactions that people have on social media is like it's all negative. It's all negative. You're living in these rare moments. You have a finite amount of time. 100 years is so quick. It goes by so fast. And you're wasting it, yelling at people on Twitter. For what? For what? Like commenting on things all day long in anger and disgust and look where this country is. Like, what are you talking about? Everyone's perspective needs a little help, needs a little pick-me-up, just a little something to go, I think we're okay. I think we're going to be okay.